Is it normal to not listen to the baby's heart rate during antenatal appointments during your pregnancy? Now, before you come at me, it is the NICE guidelines on antenatal care that does not make any recommendations relating to fetal heart rate auscultation, which is listening to your baby's heart rate during your antenatal appointments. Now, during pregnancy, that is because there is no medical benefit to doing one-off listening ins to baby throughout your pregnancy. There are so many different things that are recommended during your pregnancy, during your routine antenatal appointments with your community midwife to be asked about, to have checked over. You should be asked from 24 weeks of pregnancy about your baby's movements. You should be signposted as to where to go if your baby's movements change at any stage during your pregnancy. And also you should have your bump measured if you're not already having growth scans, and you should have the position of your baby felt at each antenatal appointment from there on in. Now, if there are concerns with baby's movements prior to 26 weeks, then the only way to reassure mum and to check baby's heart rate and well-being is to listen into baby at that stage. After 26 weeks of pregnancy, it would be recommended that you be in a maternity triage or day assessment unit, depending on where you are. And what would happen is you'd have continuous monitors, which provides a lot more detail and depth about baby's heart rate trace and any other things that is going on within the uterus. Now, the difference between listening in during labour and having continuous heart rate monitors is that when you are listening in during labour, you are plotting it on something called a partogram, and that is where you are listening in every 15 minutes and then 5 minutes in the second part of labour. And you're listening out for a baseline heart rate, you're listening out for accelerations and changings in that. You're asking the mum about their movements, you're taking maternal pulse throughout, and what you are doing is you are plotting trends over time. You're also listening out for decelerations, you're listening out to see if there are late decelerations, and you're also listening for a longer period of time too, sometimes up to a minute and a half if you're doing intelligent intermittent auscultation. Now, the difference within labour and listening in is that you're doing it every 15 minutes and you're listening out for trends and patterns, and you're listening out for far more detail where you may then recommend interventions. So the listening in happens in every 15 minutes in a first part of labour, and then in the second, the pushing stage of labour, it's recommended to listen in every 5 minutes. What you're listening out for as a midwife is baseline fetal heart rate. If there's any increase or a drop in the baseline heart rate, you would recommend going to continuous heart rate monitors. If you heard any decelerations because you shouldn't hear them in between contractions, again, you'd be recommending further monitoring through continuous monitoring. Similarly, you're listening out for accelerations. Sometimes you'll be listening in for a minute to a minute and a half, sometimes even longer. They'll be taking your pulse at exactly the same time. They'll be plotting it on something called a partogram as well, and any concerns, any variations in that, they would recommend continuous monitoring. In contrast, in the antenatal period, you could be listening in for a minute, for example, at the end of the day where your baby's very active, and have maybe a listen in at about sort of 150, and that's where your baby is normal at that point of the day. Similarly, you could go in for an appointment another day, first thing in the morning, it could be like 110, 115. Baseline heart rates also change as that pregnancy continues as well. So one-off heart rates do not give you very much reassurance other than that there is just a heart rate there right then. And so by listening in during pregnancy, sometimes it can provide false reassurance to women and people because they've heard the heart rate and they go, oh, I'm sure it's fine. I know my baby's not moving as much as they should be, but I saw a midwife this morning and my baby's heart rate was fine. And then what happens is they then delay seeking medical assistance, and they delay going in and having that continuous heart rate trace to look at their babies in more detail. And so sometimes that can lead to harm. And it's that is the reason behind why the NICE guidelines do not recommend listening in at every single appointment during your pregnancy. Now, there's only one difference in this guideline, and that is if you have hypertension, if you have preeclampsia, if you have high blood pressure at any stage, then it will be recommended to listen into your baby's heart rate. And sometimes it will be recommended to have continuous heart rate monitoring of your baby if you have got high blood pressure at some point in your pregnancy. Now, I've done the negative Nelly stuff. Now, whilst I've been all doom and gloom so far, I just want to highlight that a lot of midwives here in the UK will auscultate. They will listen in at every single antenatal appointment, anywhere from about 16 or 24 weeks of pregnancy. Sometimes they will recommend waiting until you're at least 24 weeks, because if you cannot find a heartbeat at 16 weeks, maybe because baby's in a really funky position behind the pubic bone, maybe because mum has a large BMI, for example, there's very little service or follow-up for women and people if you can't find a heart rate around that 16-week mark. So some midwives will recommend waiting until you're 24 weeks, or give you a big disclaimer that if there isn't a heart rate able to be found, they have nowhere to send you and there's nothing more that they can do at that stage. But the majority of midwives will listen in at every antenatal appointment from 24 weeks of pregnancy, not because that there's any clinical benefit, but because we know that there is a psychological benefit for women and people coming in. We know that when they hear their baby's heart rate, there's an improved connection with their baby from an attachment and bonding perspective. We know that it can decrease maternal anxieties and worries and concerns, and it can help mental health and mental well-being in women and people, and it's a nice thing to hear. But the only caveat to this is that if you have reduced movements, you should be having continuous heart rate traces. So in an antenatal clinic and a GP surgery, it's not the right place of care for that person. And it's also a good way for midwives to keep their skills in listening into heart rates up as well. So again, lots of midwives will continue to listen into the heart rate, will document that they've heard a heart rate as well. And the other benefit for midwives is it keeps their skills up, so they get to practice things like intelligent intermittent auscultation by listening into baby, documenting their findings, listening out for those accelerations as well. And so that in itself can keep our skills up as midwives, so that when we go out to home births, for example, get pulled into the unit to look after women in labour and birth, it also means that we are up together with our skill set as well. So whilst it's not in the NICE guidelines, whilst midwives are perfectly within their right to say no, they're not listening into babies' heart rates, many still will listen into babies' heart rates. No, there's no clinical benefit, but we do know that there's a psychological benefit, there's a bonding and attachment aspect. We know that women and people like coming in and listening to their baby's heart rates. But the most important thing to take away from this is, even if you listen into baby's heart rate, if you have got any concerns whatsoever about your baby's movements, you call your maternity triage lines or your maternity assessment units, who are available 24/7, and you have a proper tracing of your baby's heart rate to make sure that they are okay.